We've got no transmission between clients or staff happening, which is good news. I say that looking very serious, but actually it's quite exciting. I just had a document from the CQC, which actually was really good to see, because we've been filling in data every day, which asks us how many customers do we have, and how many people have COVID or suspected COVID, and then how many staff are off sick with COVID related things. And it came back today from the whole country, and it's showing that across the country, the care homes were when they put the data for like, that the care homes are showing 39% cases of data, but actually home care's at 19%. Yeah. So it's significantly easier, I think, to stop the transmission when you've got people in their own homes. Hi, Jane. Welcome.
Hello.
Hi. So I was just saying we're in good shape. We haven't got any cases, and generally I think home care is the good news story that the news don't want to publish, really, because they're not really interested in good news, are they? They're still being quite negative. So a 19% across the piece, 19% of home care companies saying they've got one or more people. But I think the good news is that compared to the 39% in care homes, is of course when you leave that house and you take off your PPE, wash your hands, move on to the next house, you've also been out in the fresh air. And I think there's something about that, and there's something about the fact that people who are in care homes are that much more unwell to start with. So they're already, I mean, the people who are at home are, by their very nature, they're slightly less unwell as a cohort. So we're doing all right, but we're better than that because we haven't got any cases, so that's good. We talked a bit last time about the PPE, and I have to say, Austin is on this call with me, my fellow director. He's there, quite literally tearing our hair out trying to get hold of this stuff, especially the masks. It was the devil's own job, but we now have 6 months stock. The only way to do it was to invest in a very large quantity. So I think we've got something like 22,500 masks or more, and that was the only way to do it, was to invest in enough for 6 months. So I know we had to pass on some of the cost of that, but it's there and it's safe, which is the best thing, really. We could all breathe a sigh of relief. I've had some feedback from carers and clients actually about that, and it's not easy working in those masks. The weather's getting warm. Having that on your face all the way through your working day is really difficult. So the carers are doing quite a good job. We have told them to wear one for every visit. There are guidance that says they could, in theory, they can wear it from one house to the next. I'm not very keen on that idea from an infection control point of view, but equally just from a get it off. I've told them to put cold flannels in their car and, cool yourself down again, and then put a fresh one on as you go into the next house. At least it makes the working day a bit more bearable. The other thing that carers have been communicating back to me is that it's quite difficult to communicate with someone when you've got a mask on. Yeah. They do take an awful lot of, we all do, a lot of visual clues. If I did this thing in a mask, you probably you might lose interest in 5 minutes anyway, but it's very difficult. And I think people with hearing loss, even if they don't admit they've got hearing loss, do a lot more lip reading than they realise. So I think it's quite a challenge to work. So my message to the carers was just take your time. If you have to just smile at somebody over the mask and put it back, be really careful. Once you've touched it, it's got to go. So we had lots of conversations around the practicalities of what it really feels like to work wearing a mask when you're used to having the smile is everything, isn't it? So I did see a thing on the television, actually, or the radio, that someone said that they apologised to someone in the supermarket, said, "Oh, I am smiling behind here," and the person accepting the money, whatever, said, "Oh no, I can tell from your eyes." So I think, well, we'll have to rely on the fact that there's, we can still read the expressions, but it's quite difficult. It's quite difficult with people with hearing loss or with dementia. So we're trying to just keep working with it, really. The other thing I was going to talk about was the lifting of the lockdown. I keep calling it the lift down. The lifting of lockdown, obviously, it fills me with some trepidation that all of a sudden this thing erupts again, or erupts. So we've been really clear with the carers that although it might get lifted, and it hasn't been lifted very much, have we? We had that big sort of wait over the bank holiday for Boris's announcement, but actually it wasn't much of a change, and it doesn't... at the moment, it doesn't present too much of a problem. It's just a question of giving that same message that actually go back to the basics. This is about keeping your family safe and our customers' families safe, so your families, So we're encouraging staff just to keep it really close to home. You know, I know they can go and meet one person from another house in the park, but that's not opening the doors and letting everybody in. So unfortunately, the guidance is pretty strict about that, and I think it needs to be until such time as we've got some sort of vaccine. I don't think this population of people that we look after are any safer this week than they were back in February, really. So we're just trying to keep that message really clear. Keep your home life as locked down as it has been, really. The biggest challenge, I guess, is that the children, they're talking about the children going back to school. So I had a conversation with 6 carers yesterday, and some of which had kids at school. And of course, some of those kids have been at school anyway. So they've been in the key workers school process. And they were a bit worried about other children coming back to school. But then Andrea, who works in the office in HR, she's got 3 kids at different ages. None of them are going back to school until September because it's only year 1 and year 6. So it's very limited. And what she's seen from a couple of the local schools is that they're only talking about 7 kids in a classroom. So I don't think that the risk of infection to the carers and then, you know, onto your families is necessarily going to spike because of the schools. I think the schools is going to be a minimal problem. It doesn't look too alarming. I know the teachers are up in arms, but that's a different story. I'm not sure about that one. Generally, I would say the morale in the team is good, which is nice to hear. I think it helps. I mean, we've had some very nice compliments, which has been really lovely to see, and it really boosts everyone's spirits when they get sent the online thing. I don't know, it might have been Jane actually, but we're very happy with those feedbacks. I mean, people obviously need to tell us when things go wrong, but when people bother to tell us when things go right, it gives us a chance to go, look, you're doing a really good job. We're trying to encourage people to take some time off. The annual, I think I talked about that last time, the annual leave thing, obviously when everything came to a grinding halt, so all the people who were going to go away for Easter holidays, suddenly there was this lockdown, they all cancelled leave, everybody piled back into work, and we covered all the people who'd gone off sick at the beginning. It was fantastic because it really helped, and we had a number of staff that were shielding and who won't come back to us until whenever this is over, and a number of people who were in isolation. That number in isolation with symptoms has gone right down. I think there's one at the moment who's off sick, which is a family member with a cough or something. So that it's very, very minimal. So we're in a really good position staffing. So we're starting to encourage people to take some holiday, even if they can't go very far, because they just need to pace themselves a bit. Because this is we've made it very clear. This is a long haul. You know, it's not going to. I think we're looking at someone yesterday on a conference that was to do with home care across the world almost, I think it was a European message, was very much that this is a 9-month to 12-month process. So we need to really manage our staff in the long term to make sure that they're still robust. You know, I don't want them to feel like they're running in a crisis every week until Christmas. You know, we need to balance it up a bit. So we're trying to give that very much that keep calm, carry on, or keep calm and care on, as we call it, and business as usual. And we're taking on new customers. Some people have been looking after people at home, realise it's quite difficult. So that usually happens for us at Christmas. So people go home for Christmas, or they spend Christmas with their family and suddenly realise that mum's not coping with dad, or dad's not coping with mum, or actually mum can't remember what she had for breakfast. And suddenly we get phone calls in January. So we're getting a few new inquiries, and we're just being really careful about it bringing people in as a new germ base, if you like, and particularly we're taking very few people home from hospital. The good thing about the people coming home from hospital is that it's very black and white. They've been tested, they've either had, I think 2 people or 3 people have had COVID, and they're so far down the line that the chances are they're certainly not shedding the disease, is what they call it, by coughing or spluttering. So actually they're actually quite safe. And then again, if we take someone on who's new within the community, who hasn't got any symptoms at all, we're all in masks and PPE right from day one. So I think that's not presenting us with too much of a challenge at the moment. It is Mental Health Awareness Week. So we've been providing the staff with all the resources we can lay our hands on to make sure that they're aware of their own mental health. And I would encourage you to do the same if you've got any sort of worries, or you're feeling up in the middle of the night that it's all becoming too much. I think everybody's had bad days. Everybody's had tearful days or days where you just want to run away. But there is lots of mental health support out there, lots of counselling things, and the care workers have got an app, and they can access lots of things on there. So we're just making sure that we signpost all the staff to those things. How we signpost our customers to those things is probably a bit more of a challenge, and one that you might have some ideas about. But one of the things I heard, which was quite nice, was that although they can't have visitors, actually for the elderly population, the Zoom thing's all very well, and some people are really enjoying that. But actually a good old phone call, like you said, John, didn't you? You're ringing every day. And I think that, certainly for me at home, with not seeing my kids or partner and all those things, just a quick phone call to check in is not wasted. You know, I think it's still quite nice to have that. So I think we've got an iPad knocking around. We can set up Zoom if you want to see them at any point. Let me know. We can do that quite easily. But just a quick phone call seems to be keeping their spirits up. I think for most of our people that we look after at home, this is not a massive change in lifestyle. They'd already been a bit stuck in, so that was it. So that was about it, really. That was my roundup. But did you have any questions particularly? Was there anything you thought you might hear me say?
Can I ask a question?
Yes, please.
Is there anything that any of us can usefully do in relation to lobbying for more support to domiciliary care agencies like yours?
Yes.
We hear a lot now, thankfully, about the needs of people in care homes and that part of the industry. But, you know, things like the fact that you've had to invest in, and we're all having to pay for, face masks, for example, seems unfair.
Yeah.
And I'm sure that there might be some other practical ways in which you could get better support from government. So
absolutely, there is. So so that agenda was quite nicely put into a letter. So there are two things about the PPE. One is just quite simply, you know, there are some odd comments online about, oh, well, these companies charge this money and the rest of it. None of us saw this coming, did we? Or nobody in the world. And so you're right, you know, there's this sort of funny balance of the NHS being supported. So there is a letter which I can send out after this. I'll send it out, which came from the UK Home Care Association, which is our sort of representative body, asking for, particularly for VAT to be taken off things. Now, what they've done is they've gone one step towards it. So they've taken the VAT off PPE for 3 months. But actually what people haven't really grasped is that we're paying we're paying VAT on everything, and we can never claim it back on anything. So because we're not allowed to be the rate, I don't know how much you know about VAT, but we are exempt from VAT. So we don't have to pay it, we don't have to charge you that. So the last thing we want to do is to start having to add that to our fees. But the other side of that is that if we were allowed to be zero rating means you don't charge it, but you can claim it back. So every other big business in the country, if you buy a computer, you get the VAT back. We can't claim any of that. Now that would be a really simple fix to a cash flow issue for all these small companies, because, you know, they vary in size, but the thing would be that depending on how big you were, that would be a proportionate cash flow improvement, wouldn't it? So I mean, you know, everything you buy, whether it's the hand towels for the other things that have cost us quite a lot of money are things like loads of extra cleaning stuff for the office and loads of extra hand towels and soaps and all that stuff, and we can't claim the VAT back. So that would be, so if I send you that letter, you could happily forward that. We'd be very, very grateful if you forward that to your MP or anything like that. That would make the biggest difference, I think. And I think, you know, saying how much you appreciate the fact that your mum and dad or whoever it is we're looking after is being kept out of hospital by, you know, great infection control and a good care system, just something along those lines, and actually they need a bit of support, would be very welcome, I think.
To go into the same letter?
I think it's pretty much. I think it's pretty much in that letter. But your covering letter, if you took the UK HCA letter and then sent it to your MP, but with a covering letter saying how much you appreciate, you know, the service and the fact that the other thing. I mean, The other thing is that the communication between the hospital and social services to us is diabolical. So the other thing that would be probably worth and very welcome would be to the local CCG, so Southend CCG or the local NHS, which would be the CCG, would be, where is everybody? I mean, where are the OTs and the physios and the GPs? The district nurses are doing some visits, but there's nothing going on with any of the others. They're all, so we're out with a mask, and the occupational therapists and the physios and all those other people that we need to come in and get things. So we did, because Cara and I are both physios, you know, running this thing, we've got physio between us. We've gone out and done some physio things with people, and I mean, one man, he would have gone off his feet completely. He had a bad day. He's got Parkinson's. He had a bad day. He went to double-handed care, and needed to be kept more or less in bed, and very difficult. But if we hadn't been able to do the physio ourselves, he would still be there. Whereas we managed to rehabilitate him back over a few days, and he's back now, single-handed care, one person looking after him, and he's walking again. And that we should have access to the community services. So that would be the non-money thing, would be a bit of a push to the CCGs to say, where's the community, where are these community professionals? We need them back out working.
So is that a new problem?
Sorry?
Is that a new problem, or did that
Well,
antedate?
it started obviously at the beginning, that everybody went into lockdown and they stopped. They just were like, okay, well, there were all these emails saying, you know, the community services will be working from home unless it's an emergency. You can get us by email, and that we're not doing any assessments. So we're not going out to do with that. So the social services are not doing face-to-face assessments. So it started off as a response to the lockdown, but it seems to me that no one's told us when that's coming. And I've spoken to the Chartered Society of Physiotherapy, and even they don't know at the top end. They don't know why the community services aren't working.
I mean, I'm connected with a rehab team at Homerton Hospital in London, and the person who runs that, who talks to me regularly, says she's worried that it might not ever start properly again because it's now not a priority service. So yeah, I think it's really important to do what we can do. And
they've sort of shot themselves in the foot by not coming out. They've made themselves almost appear like they're not needed, but they have no idea what's going on in the community in terms of how much people have deteriorated, so people are coming out with things like hip replacements. We had a lady the other day, hip replacement, and there's no follow-up at all in the community, which doesn't seem right at all, does it? Because they're going to be picking up the pieces in a few months' time of someone who's readmitted with, you know, having gone off their feet, or they'll end up in a care home instead.
But it's the same in Southend as it is in London. They've redeployed those therapists. So it's not that the teams are making a choice not to send them out, it's that they don't have the staff because they've been put into other settings. The more noise that we can make about it, the more sustainable those services, essential services, will be to be that network of care in the longer term. So if there's any kind of bullet points.
All right, I'll put something. That's a great idea, Jane. I will put something we're all for someone else fighting the battle on our behalf. I'll put some points in a follow-up to this and see if families wanted to. The thing's to make it easy, isn't it? Put the words together, and then all you've got to do is find who you might send it to. That would be brilliant. Yeah, thank you. That's good.
on a related but slightly different note, my mum's been getting a weekly call from the GP service, sort of like a welfare call. It started up out of the blue about 3 weeks ago, with no warning or no sort of context. This week the call came through to me rather than through to Dad, so I was able to ask a few questions. It sounds like they're just sort of seeing how things are going and what's going on, and whether you need any more assistance. But it seemed to be very sort of unstructured and uncoordinated in the approach. I don't know whether everybody's getting that, or whether it's our GP service being, or parents' GP service being proactive.
I don't know, actually. I haven't heard. I mean, the thing about lots of the people we look after is that if the phone rang and they answered it, you'd never know. Later on in the day, you'd never know. We've got lots of people with dementia that would, if you said, has anyone spoken to you on the phone, they'd never remember.
Yeah, that happens a lot. I get a lot of that, and I just sort of pick up pieces later on from other sources, and then have to try and
piece it together.
Put it together,
I haven't heard that, but it's quite an interesting, because we've had a lot of trouble trying to get hold of GPs, and they're sort of doing phone assessments, and it's frustrating because you just think, well, actually, that's not quite good enough. You know, if we were in a mask, why can't they come in a mask? I think it's a bit of a shame they've put out guidance. The guidance that came out, can you hear the dog growling? Sorry about it. I've got my daughter's dog for company because I was a bit fed up on there. The guidance that came out about when we had to go into masks, so the guidance for home care, I think what the government sadly missed was the opportunity to call that guidance for care and health at home, because that would have made a big difference. I think if someone had thought it through, I think the response was very quick to the care homes and home care because of the elderly people dying in care homes. But actually what it did was it could have been used as an opportunity to say, okay, let's get the community-based. Well, I don't understand what the difference is between a community OT or a GP visiting in a mask than there is to us visiting in a mask, really. But no, I am asking the questions, and I'm trying to move myself into a position to be a thorn in the side of whoever needs to hear, or taking a proactive approach. But you know, but it's and it is variable across the patch. I mean, we've got GPs from Shoebury, Thorpe Bay, right the way through to Benfleet, and they're all doing slightly different versions of the thing.
Sounds like it, yeah.
Yeah, so it's a difficult one, but I'll keep you updated on that one, and I'll certainly take up the offer of you lobbying on our behalf. I'll put some bits together. That's it. But generally speaking, I think we're doing really well. I'm very proud of the whole lot of them. Everybody's working really hard. But actually, when I asked the carers yesterday, how could we thank you? Because I thought, well, if I asked them in groups of 5 or 6, they might come up with a good idea of how we might do a nice thank you to each other. They're so modest that they sort of couldn't make themselves say how they might want a little thank you gift or something along the way, almost as though, well, we're doing this anyway, you know. And I think some of them actually have got friends and family who are off work, and they're quite grateful to be going to work. So I think they're quite, not just for the money, but also for the routine. Oh, well, you know, we're in a better position than some. So I think as long as we don't have them too exhausted, and they are so vocational about what they do, you can see that, can't you, from the, you know, the characters that arrive, that they just keep going and keep giving. And I think my focus at the moment is to make sure that we look after them somehow. So we've got a nice idea to send them all a voucher for a picnic, so that they're now allowed out for a picnic. We might send them a voucher for a picnic. So that was we haven't told them yet, so don't spoil the surprise. Yeah.
And do you record these meetings, Caroline?
We have recorded this one, haven't we? Austin's helping with that. Yeah, we have recorded that, so we can ping it out, and you can.
It's assuming that you're happy with that.
Yeah. I was just going to suggest. I know there's only 4 of us. It looks like there's only.
Yeah, I think so today.
That's right.
But, well, today, but maybe when there's more people at a meeting, we could also end it with a round of applause for the support teams.
Oh,
Yeah,
that would be nice.
Show them that. I mean, it's a little thing, but I think the clapping for carers.
That would be really nice.
Well received,
maybe we should change the time. If we did it at around, maybe we should do it at a different time of day. It's a very nice sunny day to stop doing everything at midday. If we did it at around, I don't know, 6 or 7ish on a Thursday evening, we could do that in, you know, about time. Then we could send it over to them at 8 o'clock, couldn't we? That would be quite nice. That's a great idea, Jane. Thanks for that. We'll try that. This dog is starting to growl his head off.
I wasn't able to make the first meeting, but I did watch the video back, and it was very helpful, actually.
Oh, you did? Oh.
Yeah, I got a sort of first-hand feedback from my wife, and my sister was on as well. But I watched it back.
That's nice.
Do that.
Oh, thank you for that. It's really nice. There was a couple who were on there from Australia, and I think they must have had to get up in the middle of the night to watch us. So that was good. So I think they're probably asleep now. They can watch it. So hello, if you're watching the recording. Where do they say that on the quiz shows? Don't vote now, or the talent shows. Don't vote now. This is a recording.
Just one kind of administrative thing. I only came across the email about this meeting when I happened to look in my spam box, I think. And I don't know why, because the messages from client services always appear in my normal inbox. So maybe I'm wrong, but I think that was what happened. And if that's happening, then other people might not be getting the alerts this either.
you're absolutely right. Austin can probably.
Yeah. We have had a little bit of trouble. We use a product called MailChimp, which helps maintain databases. So we have a database for all our internal sort of communication updates, and likewise we have one for families and clients. And I think sometimes, yes, you're quite right. The spam filters do pick up MailChimp as a no, that's likely not something that you want. We actually get it ourselves. Our Doris Jones firewall tends to pick out MailChimp and stick them into the spam folders. For the most part, having said that, the open rate on the MailChimp things that we send externally is really high. So I think they're mostly not going into spam, but maybe you've got quite a vicious spam filter like we do.
Yeah, but maybe it's worth just, because we get quite a lot of, well, the billing emails, for example, if one of the billing emails could just include, by the way, look out for and check your spam if you don't get it.
That's a good idea.
That would have alerted me anyway. I'm glad I found it.
Yeah, no, I'm glad you found it. That's a good idea. I think you can change the preferences at the bottom, can't you? Or does that help, Austin?
Yeah, if you go to the bottom of the invitation, there should be a little add us to your mailbox or add us to your contacts link, and that might help your Outlook or whatever mail client you're using to know that actually emails from the same address are actually okay.
I'll try and do that. I sometimes have more difficulty with that than there should be, but I will try it. But just if I've had the problem, then I'm sure some other people have. Yeah. So if there's just a headline somewhere that reminds people to have a look.
Yeah, that's easy to do, isn't it? We can just put that on in the week before any outgoing mail. Could have it on, couldn't it? Just a prompt.
Yeah.
Lovely. Well, it's very nice to see you. I shall let you go back to the sunshine.
I'm in it.
And you're in the sun.
It looks lovely.
Lovely blue sky behind you. And we're here if you need us for anything else. You know, we're just ploughing on, and all is well, I think, is the message. Actually, the other thing I was going to say was, in case anybody had come on this and may do later, who's not having our care at the moment, is I've started ringing those people who cancelled care because they decided, you know, the risk was quite high and they would do the care themselves. They might be looking after their own parents or they're off work. So, and I've been able to ring them back and say, look, if your workplace is starting to open and you need us back, we're ready. We're ready for you. And also the good news is that, you know, we're ready for you and it's not too risky. We've done we've done really well so far. So that's quite a nice message. So if anybody watches this later, who isn't using us at the moment, then it's nice to know that we're waiting for people to come back. We're ready for them, and as people, I think people will be quite nervous of that, going back to work, having been sort of cocooned together. I think that will be quite a challenge for some people, but you know, we are doing a good job, and we're ready for them when they're ready for us again. Anyway, it's lovely to see you all. I shall sign off. Good. Take care. Bye for now.
See you next time.
Bye, guys.